The humanist being
presents
When humanists attack.
Humanists Go on the Proactive and Have Their Say. My name is Roger Kimmel Smith, and I'm very excited to introduce our special guest on this edition of When Humanists Attack, New York State Assembly member Anna Kelles. Dr. Anna Kelles represents all of Tompkins County, including the city of Ithaca, and 5 townships in Cortland County, including the city of Cortland. In 2020, she defeated 5 of her fellow Democrats in a contested primary, then won in November to replace long-serving legislator Barbara Lifton in the lower house. And in 2022, she ran unopposed for a second term. Among the biggest accomplishments of her first term in Albany is a bill imposing a 2-year moratorium on the conversion of decommissioned power plants for the purposes of proof-of-work cryptocurrency mining. This bill also mandates an environmental and climate impact study on the energy-intensive crypto mining industry throughout the state. Governor Kathy Hochul signed the bill in December, despite the vocal opposition of New York City Mayor Eric Adams and others. Anna can also claim a certain amount of credit for saving a parcel of this green earth from likely development. 470 acres of wooded Cayuga lakefront known as the Bell Station, which NYSEG, New York State Electric and Gas, was planning to auction, but after the advocacy of Anna and others decided instead to sell to the Finger Lakes Land Trust in 2022. Before her election to state office, Anna Kelles served in the Tompkins County Legislature from 2015 to 2020. She has a Ph.D. in nutritional epidemiology and has taught at Cornell and Ithaca College. Anna Kelles, welcome to the podcast.
Thank you so much. Happy to be here.
First question. So here we are. It's the year 2023 on this planet, and you have begun your second term as a state legislator in Albany. I've caught you smack dab in the middle of the hectic budget season. Seems like the busiest time in Albany. And just wanted to ask you to step back from all that and tell me how you're feeling these days about the planet and the state of the human enterprise, and that sort of thing.
That's big, bold questions. I would say that if you're coming at it from the climate change perspective, I tell people this. Whether or not humans choose to survive, I would rather be on the ship fighting as it sinks than not on the ship at all. And I mean that in the context of being in the government. Anybody who's listening to this probably knows that I am very passionate about environmental issues, and a lot of the work I do is focused on environmental issues. I do believe that we have run out of time. And by that, I mean that there are already irreparable damages caused by human behavior.
Yeah.
And so we are now evaluating scientifically. Again, people who know me know that I don't come to politics by way of politics itself. I come to politics by way of science as a former professor. Sure. So I tend to focus on science and data and facts. And we are in the process, of course, of looking at not what we can avoid, meaning that we can avoid everything, but what is now unavoidable, and what can we still avoid if we take pretty significant, bold actions. So, yeah. I would say that would be my answer as far as where we as a species are and where the planet is with respect to our engagement with it.
Yeah, so many people don't seem to be so clear-eyed and honest about it. I'm thinking myself about, how can we shrink the human footprint, in real terms over the coming half century or century, and just get the species to stop just expropriating everything on the planet to grow this unsustainable greed, but government historically has just helped facilitate all this expropriation, right? So can we really expect governments to put meaningful restraints on growth? How does this become possible?
Well, there's the whole conversation about growth, but then there's also the conversation about our current behaviors and habits and electricity consumption in particular, and whether or not we are reducing our electricity consumption, whether we are converting it all to renewable energy infrastructure, whether that renewable energy infrastructure is produced in any way sustainably, and the materials are produced for longevity. I mean, there's so many questions in that context. I can say in New York, we do have one of the most progressive climate laws in the country and in the world. The Climate Leadership and Community Protection Act, which will require that we are net neutral on our energy production and consumption by 2050. We have a deadline by 2030. That's 40%, 50%. Which we are working towards. There are some of us that believe that we're not moving fast enough, but that is something that I would say we're aggressively working towards. There's other things though that we need to. There's endless things that we need to do, like for example protecting our water, like for example addressing the fact that we have massive harmful algal blooms increasing, and we have significant amount of PFAS and PFOA, forever chemicals, in our water sources, and that almost every human, particularly in the developed world, has a slew of different PFAS and POAs in our body, in our bloodstream, in our cells already. Some really interesting data just came out about the cognitive impacts, as well as the long-term cardiovascular disease and cancer risks of having so much of this in our bodies. So there's, of course, water, and we only have like 0.4%, as far as I understand, of all water on the planet is fresh water. And less than 1% of that is accessible to humans, meaning it's not frozen, and it's surface water, or at least aquifers. So if we look at like New York, for example, we have all the Finger Lakes and we have the Great Lakes. It's a significant portion of the world's fresh surface water. And we have more harmful algal bloom outbreaks than we've ever had before, continuously escalating. We have skyrocketing amounts of PCBs, PFOAs, PFAS, and PFOAs in our water. So we have some serious work to do with respect to protecting our natural resources. And then we look at waste. We have Seneca Meadows. It's a landfill that is 35 building stories tall. 28 building stories tall. And this Texas company has just requested to extend the date in which they are asked to close. Right now, it should be, I think, by 2024, and they want an additional 15 years, which would add about another 7 stories to equal about 35 building stories of trash that are stored in the landfill just north of Seneca Lake. So of course you can imagine what impact that has on groundwater. So being honest, we have some major issues we need to address. At least we're having the conversation. I appreciate that we're having the conversation. I'm carrying a bunch of bills to try and address some of those, but I don't think as of yet we're moving fast enough. But I am thankful that there are way more people in the legislature that get it and care about it and are fighting for it than I would have thought prior to coming into state government, which is extremely refreshing.
Yeah, well, it's good to hear you say it. I'd like to hear more about your background and backstory, because, I met you before you decided to run for office. We met through friends in Ithaca, and I knew you were someone politically engaged on the local level. So I'd like to hear you talk about your life, from early on up to the point we met, which would include your Ph.D. work in nutritional epidemiology and your work in Ecuador and your work in nutrition?
Mm. Well, I grew up here. I grew up in Trumansburg, actually, on a dirt road. My dad was the dentist. My mom worked at Cornell, so I'm a local through and through. They were part of a sort of philosophic, spiritual community called Wisdom's Goldenrod that was very highly connected to uh, the Dalai Lama and efforts to make sure that Tibetans were safe in the 60s and
Oh.
70s. So I had a
Did,
very interesting
did I,
childhood.
did I hear you right?
Excuse me.
Wisdom's Goldenrod?
Uh-huh. Uh-huh. It's sort of a philosophic center of Eastern philosophy. Studies of Eastern philosophy. It's on Seneca Lake, actually. But highly intellectual, people studying Plotinus and Socrates, and so Eastern and Western philosophy, right?
Mm-hmm.
To the to math, even, right? Like the philosophy of matter and reality through, in a study of Euclid's Elements, right? They were intellectuals. They were studying kind of everything across the board. Um, which was my childhood. So I think it definitely colored the way that my mind works. Having
Yeah, sure.
conversations about what is the ego, what is the overself, how are you self-identifying with your identity, um if that makes sense.
Definitely.
uh
Question of
was that
self and Atman
of
or
course, was great. So an odd background, I maybe, for um
no,
a
it
person in
actually
politics.
makes me understand, on a perhaps more pragmatic level why we have so much in common in how we think.
Yeah, yeah. Well, so I went from that to SUNY Binghamton. So I was like high school here, SUNY Binghamton, where I studied biology and environmental studies. I had a professor who died last year, which was deeply sad to me. His name was Richard Andrews.
Mhm.
Stunning human being, cantankerous and funny and brilliant. Studied sphagnum moss, but he took students every year with another faculty. We had a tropical ecology class, and we would go to Costa Rica to study the different ecosystems and the impact of climate change on the ecosystems, so that we could understand not just temperate zone, but the tropics. He had several classes on temperate zone ecologies as well. So he wasn't simply on the tropics, but a globalist in as far as his work in the environment. And I remember him coming into the first day of class like Indiana Jones. I mean, he was like sparkly eyed and passionate about it. And I went in as thinking I'd be a theater major, and like that day is when sort of my life shifted,
Uh-huh.
because I knew I cared about the environment. I'd cared about my entire life, but I don't know. There was everybody has not everybody, but there are a lot of people who have stories about a person or a moment that changed their lives. And that was certainly one that like redirected. And when I added a focus of biochemistry and nutrition and biology, because I had had a lot of health issues growing up. My father did. Turns out we all have a genetic autoimmune disease that's certainly very impactful in all of our lives. But even at that time, I was very driven to find answers. So I had two worlds that I was walking in: human health, planet health. If you look at my life, everything I have done has been the interface between human health and planet health.
Mhm.
From being a guide in the Amazon after doing a couple of years of independent study and research on nutrition in a very impoverished area of Ecuador. I ended up going back and teaching high school biology, and then went back and was a guide in the Amazon. Again, back and forth, nutrition and environment, and came back to the United States only to do a Ph.D. At UNC Chapel Hill in nutrition, but it was nutritional epidemiology, so very heavy epidemiology focus and
Yeah.
international nutrition in developing countries. So,
So how
so
nutrition and diet tie into disease and wellness on the level of whole populations?
correct. But I was specifically looking at the change over time in urbanicity and affluence of so the change in the built environment and sort of the jobs people have access to, the what existed in their environment with respect to the foods they had access to, the passive forms of entertainment, and all of those things shifted over time. What
Hmm.
is the impact on obesity rates, physical activity rates, um, health overall in a developing country context, which we can sort of watch real time what the impact of a Western culture is on in a developing country context, which was pretty fascinating experience. And then moved on to be the dean of a school of nutrition. I ran a nonprofit, an environmental nonprofit, helping businesses transition to a triple bottom line of people, planet, profit. Did a lot of advocacy and activism work for the American Nutrition Association. I built a nutritionadvocacy.org website to help people who are in the nutrition world understand where they could practice in the United States, and where sort of the industrial food complex had gotten a stronghold on what what certifications would be needed in what states, and where people could practice and what people could practice. So I did a lot of work on that for years, and then shifted back into the environment locally here in Ithaca when I, was living here after my
Wow.
PhD. So it's a very windy road.
Right,
It's a
right.
very windy road.
But you answered my question. You brought us to the point where we met, which was,
Where you met me,
oh, right.
advocacy and activism.
But I guess, in that story, it was just shortly before you had the idea of politics, you know. And it's clear
Yeah,
you
well,
had the talent for it, on the retail
I
level. I mean, not just from the evidence of your electoral record, but in your first campaign, I spent an hour with you knocking on doors in Ithaca and talking to your neighbors, and I was deeply impressed by your doorstep manner, how you connect with people. Plus it's clear
yeah,
you're a very hard worker, that just seems to be your habit, and a PhD researcher. So you have a lot to
yeah.
contribute, I suppose. How do you
I
figure
feel
that?
like I have a brain that moves really fast. Um, I have filled it with a lot, and I feel like I have a responsibility to use it in a way that's helpful. Maybe that puts a lot on my shoulders, but it's just the way it feels to me. Maybe it's the way that I would like to both live and die, knowing I was fully invested. If that makes any sense.
Well, sure.
Um,
That comment you made at the beginning about being on the ship,
yeah,
that's
yeah,
that's what the
yeah. I mean,
movies
I
say.
remember two things that one my mother said, and one I actually. There's been a couple things that people have said to me in my life that have been really important. My mom said to me once, Anna, it's arrogant to think that you can dictate to the world how it chooses to receive you. And it sort of kind of stunned me into silence because it was such profound wisdom. And what she was saying, in a way, my experience in the moment was like an instant feeling of tremendous relief
Aha.
and a shift in focus. Because, there is that feeling like, if I just work hard enough, then of course I'll get that grant. Of course I'll get this thing. Of course I will succeed in passing this bill. Of course I just need to work hard enough. No, actually, sometimes the world is not choosing to meet you in the place that you want them to, or that you want it to. And if you can let go of the belief that you can dictate to the world how it chooses to receive you, then you can actually invest more wholly and fully and joyously and completely in doing it, because you can't control the outcome. You can't guarantee that if you work hard enough. So, then you end up working really hard because it feels right to you, not because you think it's what the world must do. And that's what I meant before of, well, the humanity may not choose to survive. We do have choices. Like the science is clear that if we do not reduce our total global greenhouse gas emissions by 50% in the next 7 years, then we will not be able to prevent, some of the predicted worst outcomes that have been outlined in some of the research. And that's a choice. So
Yeah.
I am not going to stop doing this work just because I may see at some point we may not be choosing to walk a path that would, minimize suffering and guarantee species survival. That I can't string my happiness or my motivation or my drive on that. Does that make sense?
Yes, it made sense. I guess I would just follow up by asking, now you're in Albany. This is the big leagues. I think there's a natural kind of dichotomy or dialectic between two views of politics. One where, it's hard power, and the other where it's the notion of politics as serving the public interest, as service and civic responsibility, which I'm hearing in your underlying rationale. And these are humanist values. Of course, I perceive you as a power with, not power over kind of person fundamentally. So how do you think about the notion of power these days, and has your view changed?
Well, in my perspective, it's service. And I can't dictate that to how everybody else perceives it, but in my mind, you have power. It's power is responsibility, and for me, responsibility is service. But I'm also, just by the way I was raised, of course, it would make sense that I led the life that I have so far, but I'm also a trained public health researcher. And in public health, we are studying everything on a population level, not on an individual level. So there may be decisions that you have to make. Government is about making decisions for the whole population, because any decision you make is going to affect the whole population. And I don't know a single decision that's been made that I can think of that has benefited 100% of a population. So then it's the question of, okay, where are my priorities? I'm going to make this decision. It is going to have potentially negative impacts on a part of the population, or some people. How do I maximize the benefit and minimize the harm, and accept the fact humbly, painfully, that I cannot, with any decision I make, most likely do like zero harm. And that is like fundamental to public health. Anyway, because you are studying a population, you're stepping back and looking at public health, right? So you're looking at what would improve public health. Well, through the history of time, some of the greatest public health actions have been creating, water infrastructure, creating, wastewater infrastructure, so that we could improve sanitation. Building code, a lot of it is specific to protecting the majority of a population from building collapse, and the building code modifies based on what part of the world you're in, and seismic activity and water quality and floodplain, right? Like all of those types of things are government actions that have sort of a public health, to me, mindset. and not everybody appreciates the building code, and some people it affects their livelihood. But
Mhm.
I need to, in that public health mindset, yes, but it might affect negatively some people's livelihood, but it'll maximize health of the society, which impacts everybody. Um, so to me, having that mindset and recognizing that your job is to maximize benefit and minimize harm, and accepting that sort of humility that you you are not allowed to not make decisions. Like, I'm not allowed to say, no, I'm not going to vote on this thing that came to the floor. I'm not allowed to abstain. Therefore, every decision I make is going to affect people both positively and negatively.
You're not a
So
can
that is a
kicker.
very well, it's a very philosophic, sort of roundabout definition of power.
Aha.
But that is, in this context of government, yes, you have power. Are you using it for personal gain? Are you using it in what I believe government should be, which is recognizing that you're making decisions for an entire population, whether people agree with your philosophy, whether people agree with your politics, whether you're still making decisions that will influence those people, and holding that in your mind's eye as you're making decisions is really the greatest, I think, most responsible use of this power in this role.
Yeah, but what I'm hearing is, that your viewpoint and your training align you to a certain view, this public health view, very clear definition of the public good, and increases both your motivation and the soundness of what you have to say when you speak from that frame.
Well, I mean, I can say certainly that I try, at least, and I also, it irks me just viscerally when decisions are made based on anecdotes, because I know from an epidemiological perspective,
Hmm.
you cannot say whether that anecdote is representative of the population norm, whether it's representative of any trend. It could be an outlier, could be totally unrepresented, and you were cherry picking to to suit a personal perspective or gain. I fight that a lot in the criminal justice reform work that I do. For example, we
Huh.
see a lot of tension going on in that. We see it a lot in the environmental discussions
Well, you're going up, against time-honored traditions of rhetoric. Uh, I just
of technique,
yes, 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 of course.
intentional. Yes,
Let
yes.
me just ask you. I have to blurt out the question now that you've spent an entire term in Albany. What is it like dealing with your colleagues across the aisle? I mean, we're still in what seems to me to be an ongoing crisis of democracy, or threat to democracy. What do you understand about how your fellow members think and operate?
I think it's very dangerous to other any group. And so for me, and I gave a speech on this actually earlier this year because I was so incensed um, about some of the things I was seeing on the national and global level. And we had a Holocaust Remembrance Day, and I was talking about the danger of othering. And the minute we find ourselves othering, it should be a really big flag. Doesn't matter who you're othering. So to say the people across the aisle is like, still, even if I don't agree with a lot of the philosophy, a lot of the politics, a lot of the perspectives, there is humanity. There are humans, quote unquote, across the aisle. So if there are humans, then there's just as much diversity in personalities. There's just as much infighting among them as there is among Democrats, right? Like, so for me, my work is to reach out and try to build human relationships with humans in the room, some Republicans, some Democrats, and where we agree, I will acknowledge and admit that we agree. And where we don't agree, I have made it very, very clear that I will debate passionately against their perspective, but I do not take it personally. My job is to fight for what I believe in and what my constituents have sent me there to fight for, and represent my constituents to the best of my ability. And sometimes it's my constituents that I don't agree with. And it's because I may have gotten access to a lot more information. Well, I could do two things. I can just vote the way that I believe that is good for humanity based on the information I have and not say anything and just create tension. Or I can try and take extra time that I can maybe try and find eked out between the minutes of this crazy job and educate, share the information that I have to the best of my ability. And so, I would say it's on both sides. There are certainly times where some of the mentality of across the aisle, I have to take a deep breath and walk out of the room for my own mental health, because it's so in contrast to what I believe in my heart is the way to govern to serve the good of the most people. And then, I will debate and I will argue and say my piece. And if I have to step out of the chamber and give myself 5 for my own mental health, I do that.
Okay.
Does that in-depth answer your question?
Yeah. I will follow up by asking about areas where you may have found, across your committee assignments that you can connect fruitfully and work together, and find shared notions of the common good.
Here's two examples that have been very refreshing. One is, so we have a system in the United States of EMS services, ambulances, where it has been based on a model of volunteerism for the last 100 years. And like firefighters, so many of them are volunteers. Emergency medical response people, paramedics are more often paid, but not always. And we have a society where wages have not kept up with the cost of living, and the ability to, even if you wanted to volunteer, the ability to volunteer is less in reach for a lot of people. And yet there are still some people heroically that, on top of everything else, making money for the family, they're still volunteering, being firefighters on their off time, and EMSs on their off time, paying for their own equipment, paying for their own training, and then working with outdated equipment of the fire station, because we haven't as a state invested, or as a country invested in the capital improvements that are needed. For example, in Cortland, they have a fire truck. All fire trucks now, standard, the large ones, every fire station has to have at least one fire truck that has a ladder, right? Of course, because buildings are bigger now.
Fire and ladder.
It does not fit into their fire station.
Oh, Lord.
Because their fire station is so old, and it would cost about $22 million to update it. Something I'm fighting for. But they need help. They need all fire departments and nonprofit EMSs, community EMSs. We overlook them until we need them, but they have been closing down across the state, like a trend that has created a crisis where sometimes there are some people in our district that have had a heart attack and called 911 and been told, you're gonna have to get yourself to the hospital. Very, very rare. But if you have a situation where 5 people have a crisis at the same time, or 7 people, or the same number of ambulances that exist in this district, or the same number of crises that happen all at the same time, there's only so many ambulances. You will hit a point where there aren't enough. And if they are closing down as a trend, then you have remaining fire departments and EMS departments and municipal nonprofits and for-profits that are increasing their service radius. So the one in the village of Trumansburg, for example, has a 250 square mile radius service area, to just give you a sense of how bad it's getting. So I have been fighting for the state to step up and create a subsidy based on mileage and call volume for all municipal and nonprofit EMSs, and to increase Medicaid reimbursement rates that would support for-profit EMSs. And I have gotten huge bipartisan support in that effort that I'm doing. Interestingly, another area that I'm finding significant bipartisan support is addressing the opioid epidemic and addressing substance use disorders that have been significantly on the rise, particularly during COVID, because you've got situations where you've got increased mental health crises, because you've got significant increased social isolation, destabilization of people's financial situations, increased homelessness, increased housing insecurity, if not, if they're not homeless, on and on and on and on. And most people don't have great coverage for mental health services. Yeah. So you end up having more and more people who are self-medicating, whether it be alcohol, whether it be pain relief, whether it be, right? And so you were seeing an increase in substance use disorder. Lo and behold, scientifically, this is not rocket science.
You don't need to be a nutritional epidemiologist. Right.
Well, an epidemiologist, sure, fine. But no, you don't. You can just watch. But as a trained public health person, I can see the interconnectivity of, what we are experiencing, not just because of COVID. These things were already crises prior to it. We have a total epidemic of mental health issues in schools, from kindergarten all the way through grad school. Crisis situation going on. Anyway, so there is real bipartisan support for focusing on harm reduction, a harm reduction model where you meet people where they are, that it's not punitive, because a punitive system for treating substance use disorder literally doesn't work. And so many people on both sides of the quote unquote aisle have personal stories at this point of family members who have died, of like so many wake-up calls where people have loved ones or know people who have loved ones that have like shocked them in their place and said, wait, we can't stand on the side and judge and say people with substance use disorders just must be weak of spirit, weak of personality. Oh, wait a minute, maybe this is an issue we really need to address. Thank goodness. And so we're having honest conversation. Exactly. And the LGBTQI conversation is becoming more and more bipartisan. These things that are affecting our lives personally. So we're having conversations of how can we really address it, that we need to invest more in mental health, that we need to invest more in substance use disorder treatments that are harm reduction focused, that meet people where they are, that hold their hand through whatever process they want to go through, keep them alive. Because if someone's dead, you can't treat them. So, let's get off of our high horse and do what works. So some really interesting, productive, fascinating, bipartisan conversations that I've had over the last 2 years. I'm not saying everybody across both sides of the, the political spectrum, across the political spectrum as if it's binary, has this perspective, but more and more refreshingly.
No, that's a rich answer to the question I asked you, and I thank you. Assemblywoman, sure. I want to honor the time limits that you said you had at the outset. So I'm thinking maybe.
Oh goodness, yes. Sure.
One more question. Last year you got married, and Mazel Tov for that.
Yes,
and
I did.
To a fellow who it just so happens I've known longer than you, and whom I admire just as much as you, who's been an amazing builder of community through the angle of directing juvenile theater in Tompkins County by the name of Joey Steenhagen. I just want to ask, how you have been absorbing his good influence, and what would you say you have learned from him that has been applicable to your work?
It's more honestly like I mean, he is one of the most stunning human beings I've ever met. I am so flippin' lucky. He has given me tremendous resolve in, in the ways in which we're very parallel. So I'll start with that, which is that he wants theater to be accessible. When we went on our first date, he said, because when I realized who he was and some of the plays he directed, I put two and two together because there's several plays that I had seen that blew my mind.
Mhm.
As you remember, I have a theater background from my high
You
school and a little
mentioned
bit
it,
into
yes.
college. And the performances that he put on just so far exceeded any caliber that I had ever seen
Mm.
from students, that I was kind of blown away. And so I said that to him, and he kind of waved me off, not in a disrespectful way. He just said, "Those are icing. I grow children." And I was like totally smitten from that instant on. But what understanding more and more, to him, theater is absolutely youth development. It's about children learning how to do teamwork, self-reflection, if they have a feeling, how to identify that feeling, and then manifest that feeling for an actor. If they think that's the feeling that they have when a certain scene is happening, how would they manifest it in their body? How would they manifest it in their words? I mean, in how they're vocalizing. That is a skill. Public speaking skills, how to feel confident in front of people in public. I mean, there's endless skills that they're learning. And then he's very, very clear. He'll say to them, there's no way you could be the weirdest person in the world. So like, let's manifest your inner weirdo. It's like one of it's not exactly how he says it, but basically that's the essence of what he says. And that's really beautiful.
Permission.
But because of it, he made participation in his community youth theater company free for all students, 11 to 18. That's the age range. And
Jaw-dropping and
that
audacious
was,
move.
yeah, a phenomenally audacious move, because of course that took all the burden on him to fundraise the money, from the community, from members, but from sponsors as well, writing grants. And very recently, through the pandemic, he made the decision to bookend his dream, what he's always wanted to do, because he had this belief, it's manifested, that why would anyone ever know that they wanted to be in a play in the first place if they've never seen one? And so the only way he could truly make theater accessible is if he made the performances free as well. Mind blowing. I don't know anyone else who's done that, which means, of course, all of that burden on him and his team and the board as well to fundraise. But what has happened is every single play since he did that, over the last year, has had like thousands of people attend. 4,000 people attend his plays.
And what's the
The three
pragmatic
day
challenges of
performance.
mounting theater in this particular time?
He is making it accessible to everyone, something very, very beautiful that like rises people's spirits. But what I've learned from him, though, is honestly, I wanted to have children. I was not able to. He has his own child, but he raises the community's children, and watching how he engages with them, how he inspires, how he treats them with, not, we always say we should always treat children with respect. They're humans just like everybody else, but like seeing it viscerally, watching someone do it in a way that inspires such joy in children ages 11 to 18 has been really, really stunning, truly stunning. He creates a safe place, for our children.
Well, both of you are my local heroes.
Thank you. Well,
And
I got lucky. I'm very thankful.
thank you. What a rich conversation. It's always a pleasure to spend time with you, Assemblywoman.
Always. And thank you for doing this great work.
Thanks again to Assemblymember Anna Kelles and her staff for making the time and coordinating this interview. And for more information on the youth development organization known as Running to Places Theater Company, go to runningtoplaces.org. They've got a podcast too.